Well, it has turned out to be more of a serious issue than previously thought. We're talking about myocarditis happening to some young people after getting the coronavirus vaccine, both the Pfizer and Moderna vaccines. The CDC is looking into it, and we wanted to get an idea of just how big a problem this might be. Dr. Guillermo Oliveira is professor and chief of the Division of Cardiovascular Services with USF Health, Mersani College of Medicine. He's also the director of the USF Health Tampa General Hospital Heart and Vascular Institute. And he's a good friend. Doc, good to see you. How you doing, man?
Good to see you. Russell, how are you?
I'm good. I'm good. Thank you. All right, let's start with the definition, shall we? What is myocarditis?
Okay, so myocarditis is an inflammation of the heart muscle. It can be caused by a number of different etiologies, including the most common of which is viruses. Multiple viruses can cause inflammation of the heart muscle. It's similar, if you think about it, as inflammation of the liver that causes hepatitis. It's an inflammatory reaction that can have a multitude of symptoms.
From what I've read, it can be serious, it can be minor. Am I right?
Correct. Most cases of myocarditis, we believe, are asymptomatic. In other words, people don't even know they have it. There are a number of scientists that believe that even with things such as the flu, which is a very common ailment, there is a large number of people that can actually have myocarditis and not even know about it. Most cases of myocarditis are asymptomatic. People don't know that they're having it. However, there are some cases where we begin to have symptoms, and those symptoms can be chest pains, little stabbing chest pains, sometimes chest pressure. Some of them can be confused with the symptoms that you would have were you to have a heart attack, shortness of breath, and so on and so forth.
Is it a treatable condition?
Good question. That's a really good question. It depends on the etiology, and yes. The nice thing is, even if you get people that have serious myocarditis, right? Say they have myocarditis that affects their heart function, where you go from having a normal heart function to having an abnormal heart function with something that we call heart failure. In people that have heart failure from myocarditis, 50 to 60% of them completely recover spontaneously after 6 months. Having said that, there are some specific types of myocarditis that we can treat depending on the etiology.
Okay. All right. I want to get to the issue at hand here with the vaccine. We got 226 confirmed cases, and these are people under 30, and they've received the Pfizer and Moderna vaccines. Younger people, is this concern for you, and what do you recommend at this point?
So let's put this into context, right? So myocarditis in COVID. In other words, if you have COVID, your likelihood of getting myocarditis is about 5 in 100. So about 7 to 5%. We're talking about an incidence here that's still about 60 in 100,000 chance of getting myocarditis. So it's a much lower likelihood if you get the vaccine and you get myocarditis. From what I know, and from having read the reports so far, none of these cases have been lethal, and only 4 cases are actually in the hospital with myocarditis. So this leads me to believe that most cases of this myocarditis that we're seeing, which may or may not be associated with the COVID vaccine, mind you, we don't know. There are other viruses there around that are not covered by the vaccine, seem to be mild cases of myocarditis is what we're thinking. In other words, it's much more likely to get myocarditis from COVID itself than from the vaccine.
Hey, Doc, we're going to have to wrap this up real fast, but I want to ask you a question before we go. If a parent is on the fence, because I know it's happening in younger people, if a parent's on the fence about giving their kid the vaccine, what's your recommendation?
Is to give it. My 12-year-old got it. And the only reason I haven't given it to my 10-year-old is because it hasn't been approved and studied in 10-year-olds. But I would definitely recommend that every young adolescent and young adult get the vaccine, as everybody else, in fact. I wouldn't hold it for anything at this point.
Okay. Hey,
okay.
Doc, good to see you, as always.
Good
Talk
to
to you
see
soon,
you.
okay?
Good to see you, Russ.
Thanks.
Thank you.